lines. Okay. Another thing which last time we have not much discussed is the internal iliac artery. Okay, we know that the common iliac artery divides into two, external iliac and the internal iliac artery. Internal iliac artery is the smaller of the two terminal branches of the common iliac artery. At the upper margin of the greater sciatic notch, it divides into anterior division and the posterior division. Anterior division will give 8 branches, that is superior vesicle, obturator, inferior vesicle, middle rectal, internal pudendal, vaginal, inferior gluteal, and uterine. Okay, so these are the branches of the anterior division. While posterior division, only 3 branches are there: iliolumbar, superior gluteal, and lateral sacral. Okay, so here there is a mnemonic called as PILS. Posterior division has got iliolumbar, lateral sacral, and superior gluteal. So PILS, posterior division, iliolumbar, lateral sacral, and superior gluteal. Okay. Now we are about to finish now. Just concentrate. After that, we'll finish few questions and then we'll stop. Okay. Now last part is a lumbosacral plexus. Okay. Lumbosacral plexus lies on the posterior wall of the pelvis, just lateral to the sacral foramina. It is formed by the union of the ventral lamina of some fibers of L4, L5, then S1, S2, S3, which forms the roots of the plexus. The roots will divide into ventral and dorsal division and supply the lower part of the wall of the trunk and the lower limb. 6 nerves are formed from the ventral division and 6 from the dorsal division. Okay, so look at this place. Some fibers are coming from the L4, then rest of our L5, S1, S2, S3, and S4. Okay, so that will form this your lumbosacral plexus. They will divide into dorsal and ventral divisions. See, this blue is a dorsal division and green is a ventral division. Okay, and that will form this your lumbosacral plexus. Okay, so the nerves, same figure is there. Okay, so you have got this blue as a dorsal division and green as a ventral division. So from the ventral division, what you get is a tibial component of sciatic nerve, pudendal nerve. This is always asked single best question about the roots of this pudendal nerve, that is S2, S3, S4. Remember, okay, pudendal nerve, it is S2, S3, S4. This is frequently asked. The nerve to the quadratus femoris, these are not very frequently asked, not at all asked. Okay, nerve to the quadratus lumboris, quadratus femoris, nerve to the obturator internus, postcutaneous nerve of the thigh. It has got a contribution from the ventral division also, muscular branches to the pelvic diaphragm. Okay, then nerves from the dorsal division, that is common perineal component of the sciatic nerve, superior gluteal nerve, inferior gluteal nerve, perforating cutaneous branch, posterior cutaneous nerve of thigh, has contribution from dorsal division also, branches from to the piriformis, out of which you remember this pudendal nerve coming from the ventral division of the lumbosacral plexus, having S2, S3, S4. This much also you remember is more than sufficient. Okay, then there is a superior hypogastric plexus, also known as pre-sacral nerve. Okay, this superior hypogastric plexus, it is located at the level of the bifurcation of the aorta, in front of the lower part of the L5 vertebra and sacral promontory. It is formed by the union of the descending fibers from the aortic plexus. From the aortic plexus, there are some descending fibers, and third and fourth splanchnic nerves carrying the postganglionic sympathetic fibers from T10 to T12 and L1, L2 spinal segments, and also ascending fibers from the inferior. So you have got some ascending fibers from the inferior hypogastric plexus, descending fibers from the aortic plexus, and pelvic splanchnic nerves. Okay, they will form this your superior hypogastric plexus. Okay, superior hypogastric plexus will divide into right and left. Okay, hypogastric nerves which join to form the inferior hypogastric plexus. So they will divide it into inferior right and left hypogastric plexus, and that will form the inferior hypogastric plexus. Okay, we are about to finish now. I think the last slide or 1 or 2 slides more. Then you have got the, so what we have seen, lumbosacral trunk. Then we have seen the superior hypogastric plexus. Now we see the inferior hypogastric plexus. The right and left hypogastric plexus are located on either side of the lower part of the rectum. Each plexus will surround the internal iliac artery. It is formed by the union of the preganglionic sympathetic fibers from superior hypogastric plexus, which reach via the left and right hypogastric nerves. Then preganglionic parasympathetic fibers from the pelvic splanchnic nerves, that is S2, S3, S4. So it has got both sympathetic component also and parasympathetic component also. Okay. Sympathetic is coming from the right and left hypogastric plexus. Okay. From the superior hypogastric plexus. Okay. And parasympathetic is coming from S2, S3, S4. Okay. And this will further divide into various subplexuses, and that will supply to the rectal plexus will supply the rectum, then vesical plexus, prostatic plexus, uterine plexus, and the vaginal plexus, and they will supply the corresponding organs. Okay, so that is what is the significance. And yes, hardly 2-3 slides are there. Then what is the function of these sympathetic fibers? They will cause the epididymis, vas deferens, seminal vesicle, and prostate to empty their contents into the urethra. They are also responsible for constriction of the internal urethral sphincter. So sympathetics are causing constriction of the internal urethral sphincter. This is also, you should remember that sympathetic fibers will cause constriction of the internal urethral sphincter. This is a SBA. Then parasympathetic fibers will control the contraction of the muscles of the wall of the urinary bladder, urethra, and rectum. Okay, so they will cause contraction of the muscles of the urinary bladder, urethra, and rectum. They are also responsible for erection. Hence, pelvic splanchnic nerves are also called as nervi irrigantis. Okay, then superior hypogastric plexus block. Okay, this is the clinical significance of the nerve plexus is what we have seen. Okay, you have got a superior hypogastric plexus as afferent pain fibers from the urinary bladder, urethra, uterus, vagina, vulva, perineum, prostate, penis, rectum, and descending colon will reach the superior hypogastric plexus. This block can alleviate pain originating from these regions. So blocking superior hypogastric plexus can relieve the pain which is originating like a cancer pain from pelvic viscera, pelvic inflammatory disease, endometriosis, prostatitis, dysmenorrhea, irritable bowel syndrome. Okay, so what we can do is a superior hypogastric plexus block. Okay.